National Institute of Allergy and Infectious Diseases Director Anthony Fauci, Chip Somodevilla, Getty Images.
The nation's top infectious diseases expert urged Americans on Sunday to hunker down as the U.S. scrambles to avoid an explosion of coronavirus cases that could kill hundreds of thousands, or even 1 million, people here.
I think Americans should be prepared that they are going to have to hunker down significantly more than we as a country are doing, Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, told NBC's Chuck Todd on Meet the Press.
He issued his warnings as the nation pivoted sharply toward taking extreme measures aimed at containing the spread of the virus, with public health officials cautioning that things would get worse before they got better. Later Sunday, 3 states, Illinois, Ohio and California, announced closures of bars and restaurants. New York State forced the closure of schools in New York City, and the Centers for Disease Control and Prevention issued new guidance Sunday night recommending the cancellation or postponement of events with 50 or more people throughout the U.S. for the next 8 weeks.
Those announcements came on the heels of steps that have already altered the everyday life of Americans. Sports seasons have been suspended, schools have closed and gone online, employees have begun teleworking, cruises have been canceled, theme parks and museums have been shuttered, and states and cities have banned large crowds.
There were more than 3,200 confirmed cases of infections in the U.S., resulting in 62 deaths, as of Sunday afternoon, according to data compiled by Johns Hopkins University. But epidemiologists believe there are unknown thousands more cases that haven't been detected because of the testing debacle.
And the cases are rising fast, they've recently been doubling roughly every 2 days. That's the growth curve that public health experts want to flatten, using the limited tools they have, handwashing and reducing social interactions. The new measures also stem from the fact that a lot of people are still congregating, particularly younger ones who are not as high a risk for severe disease but could still infect their own or someone else's older relatives.
If the country fails to slow the trajectory, the number of domestic deaths could soar exponentially into the hundreds of thousands or even millions, Fauci warned, explicitly drawing the comparison to Italy, where more than 21,000 cases have been confirmed and more than 1,400 people have died.
Yes, it is possible. Our job, our challenge, is to try and make that not happen, Fauci told CNN's Brianna Keilar on State of the Union. But to think, if we go about our daily lives and not worry about everything, that it's not going to happen, it could happen. And it could be worse.
Within hours of Fauci's dire assessment, President Donald Trump acknowledged that the coronavirus was very contagious, but also claimed that it's something we have tremendous control of, leaving his top health experts to correct the record once the president left a briefing at the White House.
Fauci did just that, reiterating in his opening remarks that the worst is yet to come, and announcing that the CDC would be issuing new guidance Monday on steps that Americans should take to help limit the spread of the disease.
To protect the American people, we'll consider everything and anything on the table, Fauci said, including the possible closure of restaurants and bars nationally.
Administration officials did not rule out drastic measures like a national lockdown, after Fauci on Sunday morning backed doing whatever it takes to ensure social distancing.
The Trump administration will roll out so-called community-based testing sites nationwide this week that will prioritize health care workers and Americans over 65 who show symptoms of the coronavirus.
They will be set up first in the hardest-hit locations around the country and screen 2,000 to 4,000 people per day once the sites are fully operational, said Brett Giroir, Assistant Secretary for Health at the Health and Human Services Department, though he declined to give a precise timeline for when the sites would be completed.
Administration officials announced separately that the government would be distributing 1.9 million new tests to more than 2,000 public health labs across the country this week that are able to process samples faster and at a higher rate.
Hospitals, meanwhile, have raised concerns that waves of coronavirus patients could begin to swamp emergency departments and stress stockpiles of medical supplies. HHS Secretary Alex Azar alluded to those fears, and several administration officials urged Americans not to seek tests unless they were experiencing coronavirus symptoms.
Any pandemic like this runs the risk of exceeding our health care capacity, and we must acknowledge that, Azar said at the White House briefing.
The administration's coronavirus response effort has been hampered over the last month by the slow ramp-up of testing capabilities, forcing state health officials to ration tests and making it difficult for public health experts to understand how widely the disease has spread.
The new testing capacity will probably result in a spike of cases as state and local authorities have the ability to confirm cases more rapidly, administration officials cautioned.
Still, they urged Americans not to seek tests en masse, an effort to preserve the still limited numbers of tests for those most at risk. Vice President Mike Pence, however, also noted that the federal government would respect and defer to the decisions that are made by governors in response to the coronavirus.
Trump also claimed that young people, people with good health and groups of people just are not strongly affected, contradicting Fauci, who insisted earlier on Sunday that everyone should take the virus seriously, including young people. Elderly and sick people are disproportionately at risk, though.
Younger people are not immune or safe from getting seriously ill, Fauci said. There are going to be people who were young who are going to wind up getting seriously ill. So, protect yourself. But, remember, you could also be a vector or a carrier. And even though you don't get seriously ill, you could bring it to your grandfather, your grandmother or your elderly relative.
In a Dear Colleague letter to members of the House, Speaker Nancy Pelosi, D. Califf, on Sunday thanked lawmakers for passing a bipartisan coronavirus response package over the weekend to provide economic relief to families and free testing for the virus. She said the chamber had already started working on another package, and encouraged members to take steps to promote social distancing within your Washington, D.C. office during the current recess after consulting the chamber's attending physician and sergeant-at-arms.
This may entail more than half of your Washington staff teleworking from home, she wrote.
One former aide to Representative Adam Schiff, D. Califf, chairman of the House Intelligence Committee, tested positive for coronavirus on Sunday. Daniel Goldman, 44, who led the panel's questioning during the impeachment inquiry in November, had been seeking a test in recent days after exhibiting symptoms and testing negative for the flu.
In a statement on Sunday, Schiff revealed that a former staffer had contracted coronavirus but didn't identify Goldman by name. Goldman left Schiff's office earlier this month, and Schiff indicated that doctors believed that the former staffer contracted the illness after his departure.
The National Institutes of Health told staff in a memo Sunday morning that an individual who works for the National Institute of Arthritis and Musculoskeletal and Skin Diseases but is not involved in patient care was being quarantined at home after testing positive for the virus.
While this is an unfortunate development, it is not surprising, and NIH expects that there will be more cases of infection among NIH staff, NIH Director Francis Collins said in a statement.
Ahead of Sunday's announcement, NIH had already announced steps to shift its staff toward remote work beginning on Monday. In the email, Collins also acknowledged that many staff would need to remain on site to continue to support the NIH's facilities, conduct research and other in-person activities.
Back at the White House, Trump held a call with more than 24 grocery store and supply chain executives early Sunday afternoon.
Shoppers across the country have encountered long lines and empty shelves in recent weeks as the outbreak has spread. And food retailers have begun overhauling their operations, reducing store hours to give employees more time to restock overnight, limiting the purchase of specific food items, urging customers to bring their own shopping bags, and adding grocery delivery and curbside pickup options.
You don't have to buy so much, Trump urged consumers. Take it easy. Just relax. People are going in, and they're buying more. Relax. We're doing great. It all will pass.
A readout from a White House spokesman, Judd Deere, similarly discouraged Americans from hoarding.
All of the executives are working hand in hand with the federal government, as well as state and local leaders, to ensure food and essentials are constantly available, Deere said in a statement. The president reminded the participants that this is an all-of-America approach and each of their stores and the stores they support can help Americans feel calm and safe when shelves are stocked with the items they need. Supply chains in the United States are strong, and it is unnecessary for the American public to hoard daily essentials.
In an interview on ABC's This Week, the White House economic advisor, Larry Kudlow, guaranteed that there was enough stock in the supply chain for people to be able to provide food for their families at home without running out of supplies, though he noted that there may be some exceptions.
I've read about some situations where this is a difficulty, but most of our supply lines are working pretty well in the domestic United States, Kudlow told host Margaret Brennan.
The White House expanded its European travel ban on Saturday to include foreign nationals from the UK and Ireland, and Trump has said he is considering restricting domestic travel. Other nations that have been hit even harder by the global pandemic have also announced drastic measures in recent days.
Italy and Spain are both on lockdown. France has closed all non-essential businesses, markets, pharmacies, gas stations, banks, newspaper stores and places of worship are examples of places deemed essential. Germany, meanwhile, will close its borders with France, Austria and Switzerland.
Across the U.S., Fauci called for a dramatic diminution of personal interactions at places like restaurants and bars, something the governors of Illinois and Ohio announced on Sunday despite pushing forward with their planned primary elections on Tuesday.
Gov. J.B. Pritzker of Illinois said bars and restaurants across the state would close on Monday through March 30. Those establishments, however, can offer curbside and drive-through options.
This is another hard step to take, Pritzker said in a statement. The time for persuasion and public appeals is over, the time for action is here. This is not a joke. No one is immune to this, and you have an obligation to act in the best interests of all the people of this state.
Gov. Mike DeWine of Ohio similarly said all bars and restaurants would begin closing at 9 p.m. Sunday across the state. Establishments can stay open for carry-out and delivery, he tweeted. What we can't have is people congregating and seated.
California went a step further, with Gov. Gavin Newsom calling for all bars, wineries and brewpubs to close, and for senior citizens and residents with chronic conditions to isolate themselves at home.
Ohio has already closed its schools, limited the number of crowds and restricted access to nursing homes and prisons. On CNN, DeWine added that it was absolutely possible that schools in Ohio would remain closed through the end of the year.
This may not peak until the latter part of April or May, he said. So, we have informed the superintendents, while we have closed schools for 3 weeks, that the odds are that this is going to go on a lot longer. And it would not surprise me at all if schools did not open again this year.
An increasing number of people have begun comparing the coronavirus outbreak to war, including Mayor Bill de Blasio of New York, who urged the federal government to realize this is the equivalent of a war already.
To that effect, Gov. Andrew Cuomo of New York called on the Trump administration to mobilize the military to deal with the outbreak.
States cannot build more hospitals, acquire ventilators or modify facilities quickly enough, Cuomo wrote in a New York Times op-ed. At this point, our best hope is to utilize the Army Corps of Engineers to leverage its expertise, equipment and people power to retrofit and equip existing facilities, like military bases or college dormitories, to serve as temporary medical centers. Then we can designate existing hospital beds for the acutely ill.
Cuomo said the use of active-duty military personnel shouldn't violate federal law because the coronavirus pandemic is a national disaster. Doing so still won't provide enough intensive care beds, but it is our best hope, he said.
Gov. Phil Murphy of New Jersey told WBLS-FM radio on Sunday that he was considering several steps to mitigate the spread of the virus, including a statewide curfew.
Meanwhile, 6 in 10 respondents of an NBC News, Wall Street Journal poll said they thought the worst of the novel coronavirus pandemic was yet to come. But a majority of respondents also said they expected their lives to change in only a small way, or not at all.
Kyle Cheney, Ryan McCrimmon, Dan Diamond and Dan Goldberg contributed to this report.